Good evening, everyone. My name is Mark Levine. I am a licensed independent chemical dependency counselor, life coach, and founder of mindsatpeace.net. And so glad to have you all here, and know there's a few people who aren't watching football right now. But I wanted to take a little bit of time. The title of this talk is You're Not Codependent, and the subtitle is Empowering Families in Addiction. So we know the problem in that addiction has become rampant throughout the world, particularly in this country. And in the Jewish community, we tend to sometimes ignore it and pretend that it doesn't happen to us. But we know, in fact, that it happens to everyone. And so I want to give the family members watching, and maybe somebody who is challenged by addiction might be watching as well, a couple things just to think about as we try to have a little bit of a different attitude in the way we approach the people that we love, trying to help them. And so let me start off by first of all saying that sometimes there is this notion that you can't really help anybody. You have to wait until they want to change, and then they'll decide to go into treatment. And so what I want to talk about today is the fact that actually family members are in a particularly important place to be able to make those kinds of changes and help family members. So we'll talk about that. And so I want you all to know that you have the ability to be able to impact those people that you love in a very positive way. So I want to start, first of all, by going back to kind of what we mentioned about codependency. Well, what is codependency? And that's actually a really great question, because I can remember having a course in grad school on codependency, and on the very first day of class, the professor handed out a piece of paper with 18 definitions. So no one can actually agree on what it is. And it's probably one of the major reasons why the American Psychiatric and Psychological Association do not recognize codependency as a clinical disease. And so that's why it's not in the Diagnostic and Statistic Manual, or the DSM. And so when I talk to people about addiction, and you're a family member who is challenged by someone who is maybe creating all sorts of drama inside your family circle, and you may feel like you're a part of the cause or part of the blame. And so let's get rid of that notion, first of all, in that, first of all, there is no one to blame here. And that when we talk about even the family dynamics of things that can contribute to somebody that might have developed an addiction, it's all from the context of understanding. Never is it in the context of blame. That gets us absolutely nowhere. So let's talk about that. But the other piece about, am I codependent? And so the best way, I think, to be able to talk about that is to say that when you have a family member who is challenged by addiction, and there is drama after drama in your face, is that the way you react is basically you're reacting normally to a highly abnormal situation. There's nothing that we need to pathologically describe that behavior. All of us, faced with really extraordinary situations, are going to act in ways that other people might describe as codependent or even enabling. And so rarely is that actually the case. So one of the things that I want to make sure that have a chance to express to you all before we end tonight is some couple important skills that you can use to be able to address the loved ones in your life. And so first of all is the notion that all behaviors make sense to the person engaged in the behavior. So when you look at someone who is engaged in a drug or alcohol addiction or substance misuse, you might look at them and say, well, that's just crazy. That doesn't make any sense. Why do they do that? And so at any point in time, when you find yourself asking or making that comment, that just doesn't make any sense, I'd like to ask you to stop and pause and recognize it makes sense to that person. And so your job in this particular case is to try to understand what exactly is going on. Why is that person engaging in behavior that to me doesn't make any sense? So when it comes to substance abuse, we often look at, well, what are some of the reasons why somebody might choose to be drinking or using a substance? And if we run down all the lists, and if you actually interview people, as I have over the years, and you ask them what the reasons are that they are using, and you put them on a piece of paper, and I read you the list and said, hey, if you knew anybody that had these problems, would you recommend that they do something about it? And I guarantee you that you would all look at that list and say, oh yeah, you should take care of that. You can't sleep, you're not making friends, you're feeling a lot of shame, anxiety, depression, you should do something about that. And then when the person finds alcohol or a substance as a way of coping, then of course that creates a whole set of other problems. But until you understand the underlying reason for why they are using, you really have a hard time communicating. And so the whole point of being able to engage your loved one is not to lecture them. And it's not to simply keep saying, I don't understand what you're doing, you need to go to rehab. You don't want to just keep saying the same things over and over again. This engagement with somebody struggling with a substance use is challenging, and it does take time. It requires some patience. It requires an understanding that this is a process, that all change is a process. And sometimes people don't really want to hear that. They want some quick fixes, and rarely is that the case. It's honestly not the way we normally change. It's not just, boom, we change like that. And so sometimes hopefully the slope of the line is going up, but there's a lot of back and forth along the way. And so the value of learning, and I had a teacher who would say it's about building scaffolding for communication. Because the scaffolding is a good metaphor, because that's going to help you build a foundation for the long term. We use scaffolding to help us build very tall buildings. And this is what needs to happen. So it's not something like, I'm going to talk to this person in a way, get them to immediately go into treatment, and then as soon as they hit the door into treatment, everything's going to be fine. It's rarely the case. In fact, in all of my years of dealing with people with an alcohol or drug problem, I can honestly count on one hand how many people that I've engaged with, and from the very first moment I first started talking to them, they stopped using, and as long as I've known them, have never ever had any kind of lapse or relapse. It's just not typical. And so this is the long haul. So I want people to be able to learn how to develop ways of engaging their loved one for the long haul. And so that means that I have to learn how to understand what's going on with addiction. I need to learn some communication skills to be able to help me better engage my loved one. And I also have to do a lot of self-care in order that I can implement the different skills that we will be talking about. And so let's just take a moment and talk about one of those things, one of those skills that I think can be very, very effective. And so we talked about the value of understanding someone. And there's an acronym that is very effective in helping people communicate, not just in addiction, but in any kind of situation. But I find it particularly helpful when I teach family members how to use this with their loved one. So the acronym is SURF, S-U-R-F. I actually have a video of this on my website, mindsatpeace.net. So I'll go through it slowly. It's really quite simple, and to actually engage this with someone might take you a minute or even less. So the S is specific. The S stands for specific. In other words, if there's a topic that you want to bring up with your loved one, pick one thing, not 10. Don't make the person guess what it is they want to respond to. You might have a whole laundry list of things that you want to get across, but with each conversation, just pick one. And so the S stands for specific, and I would also add that the S could also stand for short. So there's a big difference between stating the problem in a sentence or two versus something that comes across as a lecture. And I know this from my own experience, just when my daughter was a teenager and I'd be trying to share all sorts of wisdom with her, and she would look at me and go, "I know, Dad." And that told me right then and there I was lecturing her. And so that's not what you want to do. The idea is you want to be heard, you want to engage that person. And in the long term, you want this person, your loved one, to be able to come to you when they have a problem. And if they think they're going to get lectured, well, how did that work when you were growing up? Not going to happen. So extremely important that you learn how to communicate in a way that's going to get received, right? So S is short and specific. The U is back to that understanding. So here's where, whatever the problem is that is going on, you do your best guess as to understanding what it is that's been going on, why this problem is happening now. And so let me give you just an example in practical terms. I've had a recent woman who was engaged in me as a coach to help with her husband who was drinking, and oftentimes he would hide alcohol, not very well, but in different closets and things, and she would always find it. And I would say to her, the minute that you make it about the alcohol, the conversation is probably over. He's going to get defensive, come up with all sorts of reasons, and you won't get anywhere. But if you make the conversation about, you must have been under a tremendous amount of stress that you decided to drink and then felt shameful that you had to hide it from me. That's understanding. So that's the difference between acknowledging what's happening, what I would call upstream, as opposed to the stuff that's downstream, that's in your face. So there's always the drama is oftentimes what people want to address, the things that are just right there in front of you. But what is really crucial is to understand what's happening upstream. What led to the behavior that you're seeing right now? And that takes practice, because our initial reaction is going to be, you did what? And just tend to explode. So the understanding piece, incredibly important. So S, short and specific. U, understanding. So the R in the SURF acronym is responsibility. And here's where you, as the family member engaging in this conversation, can take partial responsibility. And what might that look like? Well, maybe it would be something like, hey, the tone I used the other night when we were talking, I realized that might not have been helpful, and maybe that came across as shaming or judging, and I'm sorry about that. And when you are able to take partial responsibility, because none of us are perfect, that gives the person who you're talking to, make it feel like, okay, it isn't always me that screws up, and tends to make that person much less defensive when then you get to the F part of the SURF acronym. So the F is your feelings. So all of this comes down to that, because you have feelings about all this. And so you might say, hey, when you act in this particular way and you do your best to understand and you take partial responsibility, but you say, hey, you know what, when you do that and you drink and you drive, I'm terrified. It scares me to death. And so it is incredibly important for you to be able to share your feeling, as well as the person who is engaged in the alcohol and drug use to also be able to hear what you are feeling. Now, you want to have this conversation when there's a green light. So, not when they're drunk, high, not probably in the midst of a really bad hangover. And so it does require a little bit of patience to be able then to come back and then have that conversation when you feel like it's the best chance that it's going to be received. And you might even ask, it's like, hey, do you have a couple minutes here we can just talk? Whatever kind of thing might work for you. So that green light is incredibly important. And if you've tried having a conversation when there's been a red light, like when somebody's really intoxicated or high, you know how fruitful that, or lack of fruitfulness, that conversation will be. So you have now, this is one skill that I hope that you can use and practice. And practice is the key word. So I've mentioned two other words that begin with P, that this is a process. Change does not occur overnight. And think about every time you've tried to change maybe your diet or some other habit. Have you been successful 100% of the time? I doubt it. And that is because it's hard. We don't change all the time that way. And so you want to have some understanding about what actually is happening in this very short Instagram live here. I'm not going into all the neuroscience that's behind all this. We'll do that maybe another night. But you're going to do your best to understand what is the alcohol use or the weed use or the opiate use doing for him or her, and trying to understand, wow, we all know that our brains are reward-based learning machines. And so what is the reward that they're getting? It's not just the high. There's something else that it's doing for them. And that is really what you want to get to understand. And sometimes you can just ask. You can, it's like, listen, tell me what it really does for you. What do you love about it? It's a relationship. When someone is heavily into alcohol or drugs, it is like a lover. And so maybe you've had success in trying to get somebody to not date a particular person that you don't like, and how successful you may or may not be, trying to ask somebody to break up with the one thing that never judges, shames, criticizes, or blames them, it's a really hard thing to do. So you need to understand what it is you're up against. And that's why it's so important to practice that when you engage in conversations, there isn't judging. It doesn't come across as shaming. Shame is the driving force of the addiction cycle. You want to practice being able to just understand. And sometimes that is all the person really wants, is just to be understood. So I hope that you can practice that. And then I just want to take just a minute here also to, just because we don't really have a short amount of time here, but a very important piece of this is your self-care. And so this is not an either or thing. Self-care is not a luxury here. It is an absolute requirement. So that if you aren't taking care of yourself, if you aren't following the airplane rule of putting oxygen on yourself first, you can't help anybody else. if you aren't practicing self-care, you will never be able to calm down enough to be able to even use that surf technique or anything else that I talked about tonight. So you taking care of yourself as a priority is paramount to how to make all of this work. And so there's many different ways to be able to do that. Learning how to tap into your own nervous system is an incredibly important piece, because we are so fortunate to be hardwired by our Creator to be able to tap into our nervous system in a way that can get us into a position where we're actually able to let go of some of our stress and to think more clearly. So we want to practice getting out of that sympathetic nervous system reaction, or what's maybe people will certainly know as the fight or flight response. It's not called fight, flight, and think for a really good reason. And so we want to be able to shift ourselves from that reaction place to a place where you can respond and engaging what's called the parasympathetic nervous system that slows things down. And so there's many different ways to be able to do that. So one is certainly just by changing the way that you breathe, and by having longer exhales than inhales and practicing this kind of breathing technique. And there are many on there that you can find online. One of the ones that are most commonly used, or a couple are a ratio of 4 to 6, inhaling to a count of 4, exhaling to a count of 6. Another one is one called box breathing, which is just inhaling to 4, holding your breath for 4, exhaling to 4, holding your breath for 4. It's a little bit harder, but that can also help. I'll teach you one other thing. There is a company called HeartMath at heartmath.com that has done decades of research looking into the nervous system that's actually embedded in our heart. That there actually is a nervous system in our heart that goes up to our brain. There's way more neurons going up from heart to brain than brain to heart. And what we know is that when our heart's nervous system is in sync or coherence with the nervous system of our brain and the rest of our body, from that space, we are in a much greater place to be able to regulate our emotions and decrease stress and anxiety. And when we do that, then we are in a much better place to be able to engage those that we love. And so I'll teach you one very simple thing. No, two, because they're really, really easy and quick. So the very basic part of heart-focused breathing, simple. You start breathing as if it's coming from your heart space. So instead of thinking you're breathing just from your chest overall, I'm breathing out through my heart. And I'm breathing a little slower and a little deeper than usual. And just allowing yourself to do that. And notice if like a thought pops into your head and your heart rate speeds up and your breathing speeds up, just return back to it. A little slower and a little deeper than normal. And if you want to add just one other little piece to it, there is something called the quick coherence technique. And that is where you bring up a positive feeling of gratitude, appreciation, joy, some simcha that you remember, and you allow that memory to just become internalized throughout your body, and you hang on to that as you're doing this breathing through your heart slower and deeper. And if you were hooked up to a Bluetooth sensor, which HeartMath makes, and I have available on my website for a little bit discounted price, I use them myself every day. It's an ear clip that measures our heart rate variability, and I get real-time feedback. If I was hooked up to that machine and doing the quick coherence technique, my coherence score would keep going higher and higher and higher, and I would start feeling calmer and calmer. And so just wanted to give you a taste tonight of some things that you can do. If you want, if anybody wants to put a message right now, we got just a couple minutes. If there's something quick that I can respond to, There's more information on my website at mindsatpeace.net. So it's mindsatpeace.net. I have some videos, blogs as well. And I do have a weekly newsletter if someone's interested in usually weekly. So, and getting a little bit more information from me there. I do also run a Facebook group for helping people, and there's a free ebook called Empowering Families in Addiction, which you can get through my website. If you are looking for a particular book, the one that I always recommend is called Beyond Addiction. The lead author is who I got trained by. His name is Jeffrey Foote, Foote. And I think you will find that my ebook is kind of whets your appetite for that. And Empowering Addiction is also incredibly helpful. So I'll leave you with all that tonight, and I want to thank everyone for joining here. I'll stick around for another minute if there's a question. And otherwise, the way I always sign off when I talk to clients or sharing one of these talks is to remind you to be good to you. Start there. Self-compassion to you, and then that flows to everyone else. So how do you release control when you can no longer help? And so, depending on what you mean by no longer being able to help, Catherine, it's a great question. And it's probably not one that I can answer within a minute, but I think it starts with understanding that you are worthy of that self-care, that you practice letting go of blame, the concept of accepting what it is that's going on or what has happened is not a one-time thing. It is an active process. Acceptance is something that happens over and over and over again. Just like creation is something that happens continuously, acceptance is something that happens over and over again. And so it's not something where you want to beat yourself up, criticize yourself, well, I'm struggling to do that. Well, depending on what it is that's going on, I can certainly understand that might happen. So that acceptance piece is a process as well. And so I would strongly recommend practicing self-care techniques, whether that be something active like yoga, meditation. Recommend again the heartmath.com and looking at their information there, and see if there gives you some help there on that road to finding some comfort and allowing to let go of that control. There is a hope I can share a kind of, well, there's an equation that's oftentimes referred to as suffering equals pain times resistance. So the pain is whatever it is that's already happened. Our resistance is when we've refused to accept what it is that has already happened, the reality on the ground. So without resistance, there's no suffering. So I wish everyone else peace tonight, wherever you are. And if there's anything else I can do to help, please feel free to reach out to me at mindsatpeace.net or through this Instagram channel. Thank you all, and have a very great night. Thanks, Catherine.